Pregnancy is a very big work. Now, if somebody's normal blood pressure is 110/80, for example, when she becomes pregnant, especially in the first trimester, the first 3 months, the blood pressure will go down. And there is what we call orthostatic hypotension, in that once that person stands up, there are some things that are supposed to prevent that, but it is not very, very effective in pregnancy. So that dizziness in pregnancy can actually be malaria. It can be hemodilution of the blood. So many things can cause it. But by the time you have looked around, none of those things are causing it. What we usually advise them is that if you want to stand up, you want to go to the toilet, once you realize that that happens to you, by the time you want to go to the toilet, you first of all sit down. I don't know if you understand. You stand up from the lying position and do what? Sit down. By the time you sit down for some time, you now stand up, maybe 3 seconds or 5 seconds. You stand up. When you stand up, don't move immediately. Is it clear? You wait for some time, just so that there could be equilibration. By the time you stand up for like 2 seconds, even if people are noticing, you do as if you want to wear your slippers. Use your idea. But the moment that person stand up immediately and start moving immediately, there is a tendency for orthostatic hypotension. And usually it may happen in the late stage of pregnancy. It doesn't require treatment. It only requires lifestyle modification. Though other things, malaria can give us that, hypotension can give us that, and there are so many things that can give us that. Low blood sugar level can give us that. Again, in pregnancy, because sometimes the tummy is so big, it might prevent the woman from eating enough. So the solution to that one is to eat very, very small but more frequent. This woman now will not finish this, my mind. She will not finish it. She will just eat small and keep it. Before 1 hour, she will eat it again. So that's the way you used to do. I don't even understand. Because she cannot finish it. Because the tummy is so big, but there's nothing that will tell you, I just eat, I cannot eat again. If you look at that food and you know that the food is big, that this is the amount of food you can naturally eat, but you cannot finish it once. 3 square meal is not for a pregnant woman. You can eat as much as 20 square meal, but very, very small. And because by the time you eat that big one, if you realize there are sometimes you will be hungry and you will eat very big amount of food, you start being tired. I don't even understand. Because there's what we call postprandial hypotension. The whole blood will be directed to the intestine, giving that person a few dizziness. So small, but more frequent. But there's other things that can cause dizziness. But this thing I'm telling you are physiological causes. Even if that person is not pregnant, another way you see it is in the elderly men and elderly women. Sometimes you see them, they will just wake up, go to toilet, to urinate, they will go there and faint. Nothing was wrong with them. You now came and see them in the toilet that they cannot move again because it's orthostatic hypotension. And once that happens, it predisposes to stroke.